Hi, my name is Brent Kamba. I'll have to apologize, I'm a little bit video shy, but we'll see how this goes. But a little bit about myself. I grew up in Edmonton, Alberta, Canada. That's where I was born and raised. My parents are not from there. My dad being from Democratic Republic of Congo, and my mom is actually American. I was fortunate to grow up in a multilingual home and be exposed to several different cultures and experiences. I had the opportunity of traveling a lot through Central and East Africa, as well through Europe, and as well through Mexico, where my wife's family is from. I feel like that's been the better parts of my experiences up to date. I came down to school in Utah, where I graduated with a bachelor's in science, and I later decided, after some work experience, that nursing was the route for me. It was kind of one of those aha moments when, once discovering the field, which I never looked into before, that I knew right away that it was designed for me, that it fit my personality, and that I saw a lot of opportunity in becoming a nurse and, of course, advancing my degree to a nurse practitioner or a doctor of nursing practice. It's just, my motivations were simply that once I discovered and learned about the nursing philosophy and the approach, I knew right away that that was a career for me. And since starting, it has been a pretty direct and smooth sailing experience in school where I feel like I have been very successful. So I'm excited to continue to pursue this career and advance my degree to that final stage. I do feel like I am a very self-motivated person, which is one of the attributes I feel has really helped me be successful in this career. But starting in nursing school, I had a really great influencer as a professor. She really opened my eyes to the nursing career. She helped me understand that a nurse doesn't just have to be someone that runs around the hospital and works in that type of setting. She helped me understand that there's several ways to be a nurse in multiple different facets, and also that there's plenty of opportunity to always continue education in nursing. And that's one of the biggest motivators I have, is that there's always room to change, to improve, and to gain education in the nursing field. My first job was out in the Navajo Nation, and I had a really great manager to show me the ropes, because this was a very difficult environment to work in. It was harsh. I was on my own a lot, and having someone that could show me how to navigate through that environment really helped me be successful in this nursing career up to date. I've always had an end goal to become a nurse practitioner and to advance myself to the doctorate level. I've always wanted to be able to work in a primary care setting and to really focus on preventative care, to provide care for those who really need it, and to really focus in on preventing health problems before they become problems. That's kind of always been a mentality I've had, especially growing up in a different country and looking at healthcare from a different perspective. So the DNP will definitely help me achieve that professional goal. Well, for starters, I know that the DNP is a tough road ahead, being a doctorate degree. Like I said, I understand that it is a terminal practicing degree. I know education doesn't end after you complete, but of course, as far as the degree goes, it is the highest in that respect. I was not as familiar initially of what the difference between a DNP and a FNP is, or why pursue a DNP, except for that they say it will be required eventually. But looking more into it, I understand that a DNP has a significant role in not only providing direct patient care, but as well as managing populations and healthcare organizations, providing also administration duties. Also, they can be huge influencers in healthcare developing and implementing healthcare policy, which I believe is, I think, a big part of healthcare we all tend to turn a side eye to just because it can be difficult. But those kind of, I know Weaver State can help me develop those kind of skills, as they will be very essential in being a successful nurse practitioner. Working as a FNP is a unique role as well, where you can provide direct care. But as an FNP, it's your role to promote health and to maintain health. And I think it's very important as FNPs to provide primary care in preventing healthcare problems and preventing and providing community education and wherever you are to help people successfully live healthy lives. Growing up in Canada, I had a different perspective kind of on healthcare. Sometimes that healthcare is there to prevent healthcare problems before they become problems. And the role of an FNP really emphasizes that you have the opportunity to help people in that unique role, to help people get maintain their health versus a reactionary way of waiting for people to get sick to treat them. I think the nursing philosophy really emphasizes to continue to promote health on that continuum of healthcare, which is what I feel what I want to do in my professional career. And so the Weaver State DMP program will help prepare me for that. And it's something I'm excited to start.